prudent. We think we can do it, but it's got to be done in a way that's cautious. And I think we'll want to have time to see the effects. You've heard what Chris has said about the presence of the Indian variant and other variants. We've just got to monitor these things as we go along. I think what business would want to see getting ready for the 21st is as much certainty about that as possible, and that's what we aim to deliver. Thank you very much, Hugh. Romilly Weeks of ITV.
Prime Minister, now you're telling people to use their own judgment on hugging. Given that it is a significant factor in the spread of COVID, are you expecting people to be extremely cautious about who and how often they hug? If I can also ask who you're looking forward to hugging. And last week you said there was a good chance we could scrap social distancing rules altogether after June the 21st. The scientists doing the modelling suggest we have no idea what will happen if that is done. Would that really be a wise move in that case?
Thanks very much, Romilly. Well, I just repeat what I said. I think, and whoever I hug, I can assure you it will be done with caution and restraint. I'm not going to act it out now, but I think we all know what we mean. It's about basic common sense. And when it comes to social distancing from June the 21st, I look at the data very carefully, and I think at the moment it looks to me as though we may be able to dispense with the 1 metre plus rule. That's not yet decided. It's not yet clear. We'll have to wait and see. But it's by being prudent and being cautious that we've been able to make the progress that we have. As I say, we'll be saying more to everybody, more to business, to give everybody as much clarity as we can about how they should prepare by the end of this month, getting ready for June the 21st. Chris or Patrick, anything you want to add on the great hugging question?
Not on hugging, but I'll answer on the question about the post June the 21st. I mean, what the modellers have done is made an assumption there's still some residual reduction in transmission, and that's due to a number of things. Hopefully better ventilation. There'll still be people who are working from home who can work from home, and it's right for their business to do so. There will still be behaviours that we'll all demonstrate, which means that contacts probably won't be back to pre-pandemic levels. So on average, pre-pandemic, adults and children, roughly 11 contacts per day. Currently, it's down to about 4 or so for adults. So it will probably remain down for a while to come. It's important that we continue to isolate if positive or with symptoms. That's really, really important to reduce the number of people out in circulation who are potentially able to pass the virus on. And then, there may be other things as well required in certain circumstances. And it may be, as winter comes and if rates went up again, things like face coverings on transport might be necessary, but there's that first tranche of things, that first group of things that are really important in terms of keeping down the levels, and those aren't big impositions on any of us. They're A, what we're going to do probably in terms of how we interact with each other, and B, things like the ventilation, the ability to still stay working from home if it's appropriate to do so.
Thanks very much, Romilly. Tom Newton-Dunn, Times Radio.
Thank you, Prime Minister. Question to all three of you, if I may. On working from home, I know you're going to give business time to prepare, you said that, but so that they can start to think about it now, is working from home going to go as terms of guidance on June the 21st, or should people be thinking about that continuing through the summer, through the autumn, potentially even through Christmas? And Prime Minister, you won't say who you'll hug first, but who will you shake hands with first? And when are you going to start shaking hands again? You were one of the last to stop shaking hands, maybe. Who are you going to shake hands with when you're allowed to, and when will that be?
Tom, on all that, we're going to be giving, as I said, I mean, I don't want to be your question's a very good one, but I think we're going to wait and give you more detail and more guidance about exactly what we mean by the end of social distancing later this month. I'm optimistic that things will get back much closer to normality, let me put it like that. But clearly people are going to continue to want to exercise their own judgment, their own discretion for a long while to come. You'll hear a lot more by the end of this month about exactly what the world after June the 21st is going to look like. At the moment, I'm feeling very positive about it, but we've got to be guided by the data. Anything to add on that? Thank you very much. Jason Groves, Daily Mail.
Hi, thanks, Prime Minister. Can I ask the scientists, given the excellent data we're getting on the success of the vaccines, could this now potentially be the last lockdown that we see, barring the emergence of any terrible new variant? And Prime Minister, can I just pick you up on that last point? You've said in the past that you would like to see people back at their desks at the end of all this. Is that how you see the future? Do you think people can work as effectively there, or is working from home got a big part to play in the future still?
Last lockdown, Chris Patrick.
Well, I mean, as the Prime Minister said, this is a big step that's being taken now. The step 3, lots of things are starting up again. Over the next month, there'll be many more people vaccinated. So the balance is between opening up and getting enough people vaccinated to be protected. So it's important that we don't get out of step with that and go ahead of ourselves. I think things are really pointed in the right direction. We'll have a much clearer idea of the effects of step 3 in mid-June, so we'll know what effect that's had. But everything is pointed in the direction that the vaccines are producing very effective reduction in hospitalizations and death, as Chris has said. We know that they're also reducing onward transmission. All of that points to this now being a much smoother path. It points to a lower increase than you might otherwise have expected with another wave. And things, if they carry on without variants, are definitely pointed in the right direction.
Yeah, and Jason, on your point about what's the world going to look like? Are people going to get back to work? Do we want people to get back to work? Well, I just remember when I was running TfL, I think I made this point before, observing a sort of paradox of transport, which is that the more people can communicate remotely with brilliant electronic devices, the more able they are to meet other people over the internet or through the ether, the more reasons they actually find to meet face to face. And I'm pretty certain, and I know this is contested, but I'm pretty certain that eventually our town centres are going to be, our city centres are going to be full of bustle, full of people wanting to interact again in the way that they always have done. Now, I might be mistaken in that belief, but I've a long experience of watching the way great metropolises operate. Leads me to suppose that is what will happen. Seb Payne of the Financial Times.
Thank you very much, Prime Minister. What you've announced today suggests that the pandemic is beginning to become under control and we may be past the worst of the crisis. Where do you think it would be reasonable and not irresponsible then for Scotland to hold a second independence referendum? And for Professor Whitty, your slide showed that the number of cases of the Indian variant have doubled in the last week. Are you at all concerned this could destabilise the lockdown easing plans and could lead to a further lockdown in the autumn?
Well, Seb, on your first point, I had good conversations with all the heads of the devolved administrations, and I can tell you everybody was resolved that the number one priority for the whole of the UK was to build back better, come out of the coronavirus pandemic and build back better together.
On the Indian variant, I mean, in fact, there are currently 3 Indian variants, but the one that we're worried about at the moment in the UK is the 617.2. It has gone up very sharply, and I think that's a reason for us to be very careful about it. And there's a lot of work being done by Public Health England to try and delineate where it is and to work out ways by testing and isolation we can get that on top of get on top of the curve of that. India has also gone into the red list, which means that new people coming in will have been significantly reduced. But I think what in answer to both your question and to the previous one, what we know is with all the variants that things can come out of a blue sky, you're not expecting it, and then something happened. That happened obviously with the B117, and that has happened to India with this variant as well. So I think it would be very imprudent to say it is impossible. I think at this point in time, I think our view is that this is a highly transmissible variant, at least as transmissible as the B117 variant. It is possible it is more transmissible, but we'll have to see at this point in time. At this point in time, our view is it is less likely to be able to escape vaccination than some of the other variants, particularly the South African one, but the data are not properly in there. So I think it is, we need to be cautious until we've seen clear data that give us an answer one way or the other. The reason I've given that as a relatively technical answer is, of course, we don't know whether this is going to cause significant problems in the autumn. The way to deal with that is identify the cases, which have been happening, isolate where we can, which is also happening, get through the rest of the vaccination programme, and ensure that we have the capacity to pick these up and also to revaccinate as necessary when the autumn comes. The final point on this is the way to prevent, minimise the number of variants that circulate is obviously get on top of this as a global problem. And that is something which all of us are absolutely determined to support.
Thanks very much, Seb. Adam Bienkov of Business Insider.
Prime Minister, you were on record as opposing the last Labour government's plans for compulsory photo ID cards, which you described as a recipe for tyranny and oppression. Why, therefore, are you now planning to bring forward in the Queen's Speech legislation which would force all voters to carry photo ID in order to vote? And given the fact that there was just a single conviction in the entire country for in-person voter fraud at the last general election, and given that studies show that Labour voters are much less likely to possess photo ID than Conservative voters, what do you say to people who suggest this is merely an attempt to suppress the votes of people who may not vote for the Conservative Party?
Adam, I would say that was complete nonsense, and what we want to do is to protect democracy, the transparency and the integrity of the electoral process, and I don't think it's unreasonable to ask first-time voters to produce some evidence of identity. So that's the reason. Okay, everybody, thank you very much indeed. Thank you.